Currently, laparoscopic surgery has become a method of daily surgery due to its beneficial characteristics for the patient, among which we can name minimal complications during surgery, rapid postoperative recovery, and pain reduction. This is why in Ecuador there are institutions dedicated to teaching the management of these surgery simulators. This is the case of the Quirón Surgical Training Center. In this place, the authors developed the necessary field research to establish the requirements that a functional laparoscopic surgery simulator needs. To establish the needs of the client, the QFD method was used, in which the following quality demands were established. Visualization of the image for monitoring in real time, small camera with high resolution, low price, good lighting, ergonomic to avoid fatigue or damage the health, to have feedback on student training, what is done in practice should be recorded, different camera viewing angles. Once the client's needs are established, three main functions are established in the system. What are they? 1. Training. Here, surgical materials such as laparoscopic forceps, needles, threads, among others, will be used. Also, the structure of the surgery simulation box. 2. Visualization. A camera will be used to transmit the image of the interior of the simulation box to a TV, in which the practitioner will be able to observe in real time what he is doing in the exercise. A surveillance camera and DVR will be used to observe the exercise in real time. 3. Monitoring. It consists to use the sensor implanted in the work instrument in order to count the movement made by the student, in order to have feedback on their progress and in turn evaluate this exercise. An ESP8266 card and 2 inertia sensors will be used. For each function of the system, a selection of concepts is made through a morphological matrix in which several alternatives are specified that could be used to cover the needs of each subsystem and thus generate possible concepts. Subsequently, the concepts are selected using the PUG matrix, with which the best concept to implement in the surgery simulation box will be established. Once these filters were passed, the following concept was reached. Now, the parts of the surgery simulator that can be manufactured must be established, so a specific material is established to cover the needs raised. In this case, the materials of the pivot where the instruments are placed and the box where the laparoscopic exercises are performed will be selected. These materials were selected using the HB method. For the instrumental pivot, the elastomeric polyurethane is selected, and for the structure of the box, the PMMA polymer, better known as acrylic, is selected. To establish a correct control of inputs and outputs when using the simulation box for laparoscopy, the following process map is established. As can be seen, firstly, the operation of the recording system is verified in order to subsequently carry out the surgery exercise. While this is happening, the sensors collect all the movement data made by the students to store them for evaluation. As a result of this process, we have as outputs the visualization and recording of the exercise, the recording of the student's movement, and the material of the processed practice. In addition, obviously, to the new and improved capacities of the students for laparoscopic surgery. One of the critical elements that is analyzed is the support that joins the walls of the box. For this, a simulation of the forces acting on this part is carried out. SolidWorks software is used, in which a fine and uniform mesh is made and the forces are applied. As a result, it is obtained that the efforts are concentrated in the section change of the part and are distributed around it, so there is a very low probability that this part will fail. The literature review shows a trend towards progress in the development of high-fidelity simulators with the development of virtual reality. However, the simulation box remains the best training method since it has a feedback system that makes the student can maximize their skills and strengthen their weak points.